you what it's all about.
Welcome to the Medicaid MythBusters series, where community change action is clearing up common misconceptions about Medicaid and how it really works. Let's do a super quick refresher. Medicaid is the single largest source of healthcare coverage in the US, aiding 1 in 5 people in getting the medical care that they need. And let's not forget, Medicaid has a different name in every state. If you're interested in finding out yours, use this resource. I got your back. Each state designs its own program, but they do have to meet minimum federal standards. So services like doctor's visits, hospitalization, lab tests, prescriptions, and more are generally covered. Hi. Thanks for all this, but I heard Medicaid is only for unemployed people. Actually, that's just not true. Medicaid isn't just for those who are out of work. In fact, Medicaid is especially important for people working low-wage jobs when employer-provided insurance doesn't exist or just isn't enough. Oh, are you sure? Yeah, many working people need help getting health insurance. Millions of low-wage workers work hard for a living, but honestly, their bosses don't pay them enough to get by, let alone pay for health insurance. This is what we like to call the coverage gap. Little fun fact, when Obamacare, aka the Affordable Care Act or the ACA passed, it helped more people get health insurance in 2 really big ways. We can also look at this as ways to help close that coverage gap I mentioned before. First, it launched health insurance marketplaces where people could shop for private insurance plans, and it offered financial help, subsidies, to make the plans more affordable. Secondly, Medicaid expansion. It allowed states to expand Medicaid to cover more low-income people. In states that chose to expand Medicaid, the federal government covers 90% of the cost for people who earn up to $21,000 a year. In the 41 states and DC that chose to expand Medicaid, 20 million adults who earned around $21,000 or less got health coverage because of the ACA Medicaid expansion. Unfortunately, not all states expanded Medicaid, and there are still over 1.5 million uninsured adults with low incomes in the Medicaid coverage gap. These workers are often in low-wage jobs like retail, food service, or even caregiving. See if I get this straight. You're telling me that Medicaid is making it easier for millions of hardworking families and individuals by making healthcare more accessible? Yeah, you're getting it. One more thing, and this is really important. Republicans want to add a so-called work requirement for people who get Medicaid. What they're really trying to do is take away healthcare that everyone's entitled to and generally make it harder for people to get Medicaid. Real-life experience shows that denying health coverage to people who can't meet these rigid work requirements leads to more red tape and paperwork and less health coverage. But you know what it doesn't lead to? It doesn't lead to more people going to work. The idea that people have to jump through a bunch of paperwork to prove that they're working or that they can't because of a disability or they're a caregiver or they're caregiving or another good reason unfairly makes it harder for those who need help. It also ignores the fact that Medicaid helps keep everyone healthy by making sure that vulnerable groups get the care that they need, no matter if they're working or not. Let's consider this myth busted. Medicaid literally brings aid to those who need it. Stick with us for more facts and all the information you need about Medicaid in the series. See you in the next episode.